My name's Kayvon Alizadeh. So FCE is a functional capacity evaluation. It's a test to see if a worker can safely perform their job after they get injured. It can also be used for new hires to see if they're able to safely perform the job. It involves a series of strength tests, lifting and carrying boxes to different heights depending on the job description. And it can also determine if a worker is motivated enough to go back to work. So right now it's important because there's no other FCE certified therapists in the area. So if there's any doctors around the area that need FCEs done for their patients, this would be an easy way to get that done without having to send them far away. It can reduce workers' comp claims with patients getting re-injured after they go back to work. And it can just see if they're safe to go back to work. So if they need more rehab, they can plan to do that instead of going back to work and getting re-injured. So it can speed up the process of getting the worker back to work, and it can also determine if they need accommodations at work, like if they need to work on light duty or if there's certain things they're not supposed to be doing at the time. So I'd say that's why it's important. If there's a company that wants to hire someone new, they would just get a doctor's referral for an FCE, or if there's a worker that got injured at work, then the workers' comp doctor would write a prescription for an FCE and they would send them here and we would do the whole test. It takes a couple of hours and then we would send the results to the doctor. And yeah, so basically all we need is a prescription from the doctor to have it done. It involves a series of strength tests. The main ones involve lifting these boxes here to different heights depending on the job description, either lifting them to waist level or lifting and carrying them. But mainly just lifting boxes and pushing and pulling. Sometimes it involves hand tests, like if they're a factory worker assembling things, then it would involve a series of hand tests and strength and grip tests. That's the majority of them. Usually it's covered by the workers' comp, so it would come from the employer. It can save the worker a lot of stress from going back to work and not being able to complete their job, and it can save the company a lot of money because it's a lot cheaper to send them for an FCE and then determine if they need more rehab or if they can go back to work safely. That's a lot cheaper than them going back to work and then injuring themselves again and then having to have surgery or something else. So that would be the safer and more ethical route. So first I would do it with a lightweight, like with 10 pounds in there, and then I'd ask the worker, how'd that feel? Did that increase your pain? And then I'd ask them if they want to try more weight. And then if they feel like they could safely lift more weight, then we would add another 10 pound in the box. And we would incrementally increase it until it would be the weight that they need to safely lift to perform their job. So based on their job description, like the DOT says if it's a medium demand level, then they need to be able to lift 50 pounds safely. So if they could lift this box that weighs 50 pounds up to here safely, then I could say that they could safely go back to work. If not, then I could recommend modified duty, or if I saw fit, I could recommend that they get more therapy before they go back to work, because if they go back to work now, they would re-injure themselves or potentially re-injure themselves, which would be unsafe. But basically it's the same test over and over again until we find what level of weight they can lift safely. And it also involves lifting to different levels. So it wouldn't be just lifting to here, they would also be lifting from floor to waist and then up to shoulder level and then back down. Also lifting and carrying 30 feet and pushing and pulling. Those are the main lifts that we do for the FCEs.